hoping I don't disappoint all of you. So it's always a challenge to follow after such passionate speakers. And even though the topics have been diverse, I do feel that there's been such an overlap that I doubt if I can add anything on top of what my predecessors have already said. Um, I don't have a talk here. I have a few slides of introduction, and then I was hoping to interact more with the audience. Can I can I know how many of you are residents in neurosurgery? Okay, so now I can pick on you guys. And how many of you are students here? Dr. Mumtaz ने सबसे पहले हाथ ऊपर किया. The students, yes. So I was supposed to give a little talk on training the trainees. I will not spend too much time on it, but I would just like to share a few slides here. And this is from the Lancet Commission on Global Surgery. I wish Professor Tariq was here. He's particularly fond of this topic. So in 2015, the Lancet Commission, after years of deliberation and research, actually published their findings and also came up with recommendations for global surgery. And this has some significance for neurosurgeons as well. So just to give you an idea, and these are just numbers, but there are 5 billion people in this world who do not have access to safe and affordable surgical anesthesia. Almost 17 million deaths worldwide are from conditions needing surgical care. And this is annual numbers. And that's almost 1/3 of all deaths are actually patients who require surgical treatment. And more than 300 million surgical procedures are performed worldwide. However, although 2/3 of the world's population is in the low and middle income countries, only 6% of these surgical procedures are performed in low and middle income countries. And according to an approximate estimations, more than 140 million additional surgical procedures are needed in low and middle income countries every year. So if you think the surgeons here are busy, actually we aren't even touching a portion of the problem. And if you just look at the surgeon-patient ratios, this is from another paper in US, where there's one surgeon for approximately 86,000 people. In the extreme is the sub-Saharan African countries, where there's one surgeon for 7 million people. 7 million, that's more than the population of Bulgaria. Nick? It's just surgeons, any surgeons. And if you look at the number of, and that actually reflects on how these patients are treated. So if you look at a small developed European country like Luxembourg, Luxembourg की आबादी जो है वो 1 लाख है, बहुत ही कम है, छोटा सा मुल्क है. So there must be not more than 100,000 people in Luxembourg, right? So there are 21,000 surgeries performed in Luxembourg for 100,000 population per year. And if you apply the same on a country like Ethiopia, 148. So as the number of surgeons are less, the actual surgical care is deferred or is delayed. And if you look at the neurosurgeon to ratio to patient ratio in Pakistan, there's one neurosurgeon for 1.2 million people. I can see Hassan's mouth watering with these numbers. But yes, so as neurosurgeons, as future neurosurgeons, you are automatically a celebrity. There are 1.2 million people looking for you before you even graduate. But looking after a patient is a privilege. It's an honor, it's a privilege. It carries immense responsibility. And putting a knife to a patient, somebody who's trusting you with a knife in your hand, is another level. So as trainees, if I can just give you one advice, please do not ever operate on a patient unless you've spoken to the patient, you've introduced yourself, you've consented him or her yourself, you've examined the patient, because this privilege requires, isko izzat de, right? So you do not take it for granted. It's a responsibility and you have to respect it. So my topic itself, why research? Again, I'm only going to give you a few slides, and then I'll try and open the forum for discussion, and hopefully we'll be able to learn from our teachers here. So just recently, we've started the clinical research fellowship program at AKU, wherein we are hiring fresh graduates. At the moment, we're only hiring AKU graduates, but we are linking them to faculty and to multidisciplinary research groups with which they will be able to support their ongoing researches and think up more ideas. And we're training them and we're funding them and we're giving them office space, all in the hopes of encouraging clinical research. And I'm the founding director of that program. Hopefully, we'll be able to show you around our facility one day. So just a reminder that as physicians, we have a tripartite responsibility. So we're not just here to take care of patients, because that will never be enough. As a person, as an individual, I will never be able to take care of enough patients in my lifetime. And my responsibility goes beyond that. So only 1/3 of my responsibility is patient care. 1/3 is education. So if I do 400 cases a year, maybe in a lifetime, I can take care of 15,000 patients surgically. But if I train people and each one of them is able to take care of the same number of patients, that is where the real impact is. And similarly, research. There's a saying that unless you leave the room in a better condition than what you found it, you haven't really done a good job. So as a response, Dr. Mumtaz ne badi achhi ahadith quote ki. So it's our responsibility to document whatever we do, to improve, to enhance the art and science of our specialty, to make it better for our trainees. And that's the importance of research. Now, just to give you an idea, I still have 6 minutes about the global research and how much are we contributing. 98% of all the research, all scientific citations come from just 31 nations. And just the numbers that we saw for healthcare, also for research, if you look at the publications per million population, we're in a country like Japan, and this is actually neurosurgical research. So if you look at Japan, they publish around 240 papers per million population. And in countries like Pakistan and India, we are not publishing even one paper per 120 per million population a year. And if our excuse is that we are a low and middle income countries, we are poor, we have so much volume to cater to, we don't have time. So countries which have a worse GDP than our own, such as Kenya, Libya, Gambia, and Gabon, actually publish more than both Pakistan and India. And world over, centers are not recognized for, so when you're choosing a center to go train, there are certain things that you would look for. What is their pass percentage for the exit exam of that country? What kind of faculty they are, and the faculty become popular only because of what they publish and what they present. People wouldn't have known Majid Sami if he hadn't published, if he hadn't wrote books. And centers become famous for the cutting edge healthcare, but more importantly, centers become famous for their research outputs. And these are just a few papers to give you an idea how much emphasis is put on centers and research outputs. So this is a paper looking at trends of researchers around the world. There's another paper just looking at the trends of researchers and publications in Great Britain and Ireland. I've taken away all the tables, which is kind of boring. Again, academic impact rankings, and there are ways to gauge the academic impact. You can look at the I-10 factor, you can look at the H index, you can calculate the cumulative impact factors, and so on and so forth. So there are now easy ways, and every one of us can do it in Google Scholar, the easy ways to gauge centers on how much research they're producing. And not just research, how much quality research they're producing. So you can look at their citations, you can look at their patents, you can look at their research fundings. And these ratings are circulated, these ratings are common, these ratings are popular. And this is another paper where they've rated neurosurgical residency programs in US according to their bibliometric profiles. And again, another program looking at different departments and how much research they're doing. So you see, there's a lot of competition here as well. Unfortunately, we're catering to such a huge population. My researchers friends said you're sitting on gold mines, your piles of treasures. We're not contributing enough. We're not fulfilling our responsibility enough. So We also did a survey of residents all over the country to find out how much research they're doing, and then we did a follow-up study 5 years later. Both of them are published, and the numbers were actually quite disappointing. So in the first paper, this was published 8 years ago, we found that 85% of residents never published during their training. Although it became a little encouraging, not great numbers, but 67% still weren't. But as I said, it's not a huge sample size. So. And when we also looked at the trends of publication, we actually found out that there are only a couple of centers which are doing researches in the country. But if you look at the data from India, and there are lots of papers in Indian literature, international literature, looking at different countries. If you look at data from India, the same kind of scenario. So only a couple of centers doing researches, although every massive neurosurgical centers, lots of volumes, lots of registries, but the publications are coming from only a handful of centers. In fact, we are probably the only two countries in the world which have almost the same kind of research profile in terms of the volumes in hospitals and comparative volumes in hospitals and comparative research outputs. So with this introduction, it wasn't brief as I promised, I'd like to ask the residents, how many of you are actively involved in research? Raise your hands if you are. Okay. And what are the barriers of doing research? Why are you not doing it? I mean, एक तो हमें समझ में आता है, there's a CPSP requirement that you have to furnish 2 papers or you have to complete a thesis. How, I'm asking, what do you do beside that? So I'll change my question. So, why do you think doing research is important?
One of the problems that I've faced in doing research as a medical student is that the data collection process is painstakingly slow. I've tried to do research at Civil, at Liaquat, at OJA, but it's just been like months of just data collection. And by the time you accumulate enough data, you kind of lose the gist of research, right? So there's not really an EMR or some kind of electronic medical records where you can just pull a bunch of charts, and there's no follow-up data as well that's present.
So if we could afford an EMR, we wouldn't be a low and middle income country. The most basic model of EMR comes at $40 million price. However, let me tell you that we went through the same cycle. We don't have data collection processes in Aga Khan. During my residency, we set up data collection processes. It took us a year, another couple of years of data collection. In 3 years, you have so much data that you don't know what to do with. So it's not a big hurdle. And I'm sorry, it's not an excuse. In fact, you're fortunate that you're at a time, at a place where there are no data collection processes, because if you are able to establish that, you will have access. I mean, you will be the master of so much data that people can only dream of. I mean, try accessing data in Great Britain. It takes months of bureaucracy to be able to access it. So if you can set that up in your center, the returns are unbelievable. Anybody else?
As a medical student, one other problem that I think I face is most of the consultants aren't ready or as accessible. Like, I've done research with Dr. Salman and one more doctor, but apart from them, we don't get research as easy. As students, the most we get is data collection, and that's it. How do we go about it? There's no way you can go up to consultant and demand them.
So Dr. Tariq mentioned an ongoing study from Cambridge University where they're looking at why researches are not being done. We did our own little survey, and this is what we also found. So most faculty members who don't do research claim either that they don't have time, or they don't get an incentive out of it. So a faculty, the only incentive out of getting research is it's assumed that the only incentive is that they'll be able to get promoted if they do research. However, it's not the case. Research actually pays very well. So they're now, NIH funding actually gives you a salary for doing researches. Researchers help to maintain jobs, helps to set up departments, helps to sustain departments. So if for hardcore researchers, it's actually a very profitable, I shouldn't say profitable, but lucrative specialty. Your physician, whatever specialty you choose, will always be busy. You can't expect him to take half a day out to pay attention to you. However, that's still not a barrier, and we've all been through it. I currently have 6 students working with me, 2 research fellows, 1 postdoc fellow, and 3 residents under my supervision. They will find me in the OR. They will send me messages in the middle of the night. They'll find me in the clinic. They will stalk me around the hospital, but they will find me. So my advice, whenever you start a project with a consultant, set up a timeline. If it's possible, set up meeting timelines as well. It's not always doable, but set up a timeline and try and follow it. But you will have to go the extra mile to be able to do it. And it's not just here, it's everywhere. Clinicians are, unfortunately, Dr. Mumtaz talked about the 2x2 table about what's urgent and important. So in our lifetime, there'll be things which are urgent and important, such as rushing an extradural to the OR. You can't delay that. There'll be things which are urgent, not important, like signing a document. It has to be done. To me, it's not important. There'll be things which are not urgent, which are not important. These are the things that you enjoy doing, so you don't want to miss it. Hanging around with friends, having tea, having dinner. And then there are things which are not urgent, but important. And research and training comes there. So you have to find time for it. That's the thing, that these are the tasks that require the most motivation to enter. But these are also the things that will give you more long-term returns. So if there are no further questions, I think my time is almost up. Dr. Salman is staring at me. So, all right, thank you very much.
Thank